It is about a 7 years old boy who was diagnosed with autism. He used to play with grass. He likes to take one or two grass in his hand and he peeled out all the branches and spin it repeatedly. Sometimes he looks at it, sometimes not. So when I did the assessment, I gave him some alternatives like a straw and some slices of paper. But he was not interested. He just held it for a moment and left it. Then I gave him some fidget toys. So in the fidget toys, there were a rubber band, and the band has a wet sensation. So when the boy took it, he showed some interest to play with it. And he was playing for more time with it. So I got the information that it is not about only the visual, the spinning movement. It is actually more about the sensation, the wet sensation, because later on I got the information from parents that when the grass is dried, he doesn't like to play with it. So this piece of information really helped me to do my hypothesis. The child may likes the pressure when he's spinning. In the same time, the tactile sensations, specifically this wet sensation. So in my treatment strategy, first I tried to develop the model of this replacement behavior. So what I did, I told parents to do some art and craft activities with grass, like the child can do some painting activities with grass. He can put the grass in colors. Then the grass he can put over a paper, and he can use this actually different colors. So every time whenever he will put this grass on paper, it will give a visual sensation and it will look very nice, and he will also learn that the grass can be used for some other purpose, or we can find some more interesting activities if he's not interested to do this. And I advise parents also, in the same time I demonstrated how to do it. So when we introduce alternative behavior, so for the activities it is always start with a gradation. So I advise parents to teach him to do the replacement behavior using hand over hand instruction first. Then the next step with physical cues. Then slowly turn into the verbal cue only and make him independent eventually. In the same time, if he really want to do the spinning movement with the grass again, you can introduce the band what is similar to the grass, I mean the sensation. Now this band is actually a wristband, so you can put it in his hand also, because this is more socially appropriate. And whenever the child feel overexcited or unsafe or insecure, he can actually play with the band, so he can control himself. So it is not only one approach you have to use. You can use holistic approach, where you have to train and teach the child what more he can do with the particular objects instead of only repetitive functions. In the same time, you have to introduce some alternatives, what is more socially appropriate, and the child feels connected to it. And slowly you can give him more activities related to this sensation, like therapy. You can give him therapy and marbles. And by doing these activities repeatedly, he will not show the repetitive function with particular activities, because once his sensory systems will explore with varieties of activities with a similar sensation, the systems will be more mature. In the same time, the child will learn and develop cognitively, and that will ultimately help the child to overcome this repetitive behavior. So This approach was successful approach for this student or child. It may not be same for the other, because sometimes it happen because of lack of communication, and sometimes it may happen because of the problem with interoception. So it is very important to understand where is the problem actually have.